Good afternoon and welcome to the All Candidates meeting for the Ottawa West riding. My name is Rick Baker, President of CARP Ottawa, and it's my privilege and honor to serve as the host facilitator for today's session. CARP, or formerly known as the Canadian Association of Retired Persons Ottawa, in collaboration with the National Association of Federal Retirees and the Ottawa Council on Aging, are pleased to work together to bring these all-candidate meetings to our respective memberships in the Ottawa area. I would like to acknowledge that the land where our three organizations are located is the traditional unceded territory of the Algonquin and Anishinaabe people. Our goal is to provide the candidates within these ridings an opportunity to address key senior issues that have significant impact on our members. These key issues that we have collectively identified are the need for a coordinated national senior strategy, enforce principles and national standards for long-term care, and funding for home care. There are a few technical reminders to share with you before we move into our session. This virtual meeting is being recorded and will be shared with the candidates and those of you who have signed on to this session. We will not be having a question and answer period following the candidates' presentations, but you can send email directly to the candidate. And we have provided at the end of this presentation a list of the candidates' contact information. We hope you enjoy today's session, and is one of 8 that is being hosted within the Ottawa area ridings. As mentioned at the beginning, this session is organized in collaboration with NAFR and the COA. I would now like to introduce Mr. Robert Giroux, who brings greetings from NAFR. Robert.
Thank you very much, Bill. I'm sorry. Yes, I may have gotten your name wrong. My name is Robert Giroux, and I am president of the Ottawa branch of the National Association of Federal Retirees. Je vous transmets les salutations de notre conseil d'administration et de nombreux bénévoles qui travaillent à des événements comme celui-ci. The National Association of Federal Retirees, Ottawa branch, is delighted to be working together with the Ottawa chapter of CARP and the Council on Aging of Ottawa to organize these sessions. Notre association nationale a commencé il y a 58 ans. Et aujourd'hui, nous représentons plus de 170 000 membres actifs et retraités de la fonction publique fédérale, des forces armées, de la gendarmerie royale et les juges nommés par le gouvernement fédéral et leurs partenaires et leurs survivants. Here in Ottawa, our branch serves over 33,800 members. Based on our 2020 data, in the riding of Ottawa West Nepean, we have 3,419 members. We are an advocacy organization like CARP and the Council on Aging, and we share a vision for the future where all Canadians experience a safe, secure, and healthy retirement. We put special focus on protecting pensions and benefits of federal retirees. We make sure that every government is aware if they are looking for cutbacks or savings, our association will vigorously protect the pensions and benefits that federal retirees have earned. Our branch also focuses on education and information sharing, particularly related to financial literacy and healthy aging. To keep our members volunteers in this pandemic period, we offer weekly seminars over Zoom. We invite everyone to learn more about our activities by visiting our website, NAFROttawa.com. Our association has 4 priority issues: retirement income security for all Canadians, a national senior strategy for all Canadians, universal public pharmacare, and much improved support, care, and benefits for veterans. For today's events, the candidates, as they know, were asked to focus specifically on the national senior strategy and the dire need for long-term care standards and reform, and equally the dire need to fund adequately home care. The pandemic has exposed the terrible issues that residents face in long-term care, and its effects are not over yet. According to the Ontario government's website, over 41% of COVID-19 cases that result in deaths between January 15, 2020 and September 2, 2021 were residents of long-term care homes. We lost 4,000 seniors who are important members of our families and our communities. These are unprecedented times, and we need an unprecedented response. C'est pourquoi aujourd'hui, nous allons écouter de très près ce que les candidats ont à dire. We want to know how your party, if elected, will respond to this unprecedented situation. So I thank you, candidates, for participating, and I'm looking forward to your presentation. Merci beaucoup.
Thank you, Robert. I was hopefully going to introduce Yves Leduc of the Ottawa Council on Aging, also to bring greetings, but I don't see him right now. So when he joins, we will certainly enable him to have a few words. We're going to take a little bit of a detour today. Last week, we hosted a couple of events, and unfortunately, we were not able to get in contact with one of the candidates in the Nepean riding. So we're going to introduce Mr. Sean Devine of the NDP party to say a few words on behalf of his interest in running for Parliament and in respect to the riding in Nepean. So Sean, it's all yours, sir.
Hello everyone. Thank you, Rick, for getting me in here. Merci tout le monde pour m'avoir invité ici. So yes, I am not here today representing Ottawa West Nepean. I am representing Nepean, but I definitely do want to speak to you about your community's concerns. And if you do have friends and family in Nepean, and if you like what you hear from me today, I ask that you please spread the word. So I'm going to start by telling you a little bit about me. This is my second time running for office. I was the NDP candidate in 2015. I didn't win, but that did not stop me from public service. In fact, that's where I started. After the election, I joined my local community association where I've served for the past 6 years, 4 of those years as president. It is by far the best non-paid job I've ever had. 2 years ago, I won the United Way's Community Builder of the Year Award based on the work that I did organizing my community's recovery from the tornado that devastated my community in 2018. Community service means a lot to me. After being a good husband and a good father, I don't think there's a higher calling. So in response to the questions that you have brought to us, as more Canadians enter their senior years, we do need to make better choices so that we can meet your needs and ensure that people age with dignity. To deliver those results, the NDP will lead a national senior strategy that will work with all provinces and territories so that we can make seniors' health care a priority, so that we can reduce the isolation that so many of you experience, and so that we can tackle the poverty that is hurting so many seniors. This will also include a national dementia strategy and an elder abuse prevention plan so that we can put an end to neglect in our seniors' communities. Now, I want to talk about dementia a little bit, and this will be a little personal, but it's also going to bring me to your questions about long-term care and home care. So both of my parents passed away last year. My father died last August of cancer. He chose to die at home. My mother died last November of dementia. She died in long-term care. My mother passed away from a form of dementia called Lewy body disease. My mother absolutely needed long-term care. My father could not take care of her because he had enough of a challenge taking care of himself. Now, both of my parents lived in Prince Edward Island, and my family is so fortunate that PEI has such a strong investment in home care and not-for-profit long-term care, far better than what we have here in Ontario. My parents died with as much dignity, autonomy, and care as they could ask for, which is all that any of us can ask for. The NDP is fully committed to addressing the crisis in home care and long-term care. 2 days ago, we revealed our costed platform, and the investment that we are making in healthcare is historic. The NDP will put more funding and resources into home care, and we will put into place national standards both for home care and long-term care. And we are fundamentally committed to removing the profit from long-term care, because caring for our elders should not be a business opportunity, it is a responsibility. Two other elements that I want to talk about with regards to our goals for seniors is our commitment to guaranteed basic income, which would help fight the poverty affecting so many seniors. And a fundamental element of our platform is our commitment to universal pharmacare. Pharmacare will not only dramatically reduce your cost of living, but it will have a cost-saving impact on our entire healthcare system. I've got 1 minute. I'll wrap this up in 1 minute. I want to leave you today by not talking about seniors, but talking about young people. Now, I really hope that all of you have young people in your lives, and if you do, then I'm sure that you care about them deeply. My generation is the first generation that is going to hand over a worse situation to the next generation. And by this, I mean my children, I mean your grandchildren. Whether it's their prospects for jobs, climate change, or housing, their future is not looking good. Our generation today, our generation has given today's youth a very bad deal. There's a reason why the vast majority of young people today are looking to the NDP to give them hope. So whether it's how the NDP can help seniors with their concerns, or whether it's how we can provide a better future for people you care about, I hope that I can get your support. Thank you very much.
Well, thank you very much, Sean, and I really see your passion and support. Hopefully you do well in the election coming up, and thank you for joining us today.
Thank you very much, Rick. Take care.
I now would like to introduce each of the candidates who have offered to speak to you today, representing the Ottawa West community. They have been provided with briefings and documentation, and as Robert said, key questions that we are asking of you. We're going to give you a specified time, hopefully in the 5 to 7 minute range. And there will be a 1 minute reminder. I'll just stick my finger up, which will mean 1 minute to go. So our first speaker today is Anita Vanderbilt, who represents the Liberal Party of Canada. Anita, welcome, and please unmute yourself. How are you?
I'm doing well. Thank you so much for having me. And I'm really pleased to be here, not just to be able to outline what we've done and what our party platform is, but also to hear your priorities. I think that's something very important, is the two-way communication. And thank you for the questions that you've raised. I'd like to start by noting that our Liberal government is the first government in history to create a minister for seniors. And what this means is that seniors are at the center of every cabinet discussion, every policy, that there's interdepartmental coordination happening because of the fact that there is a full minister at the cabinet table whose entire portfolio is about seniors. I'd also like to address some of the things that we all saw in the last year and a half, particularly here in Ottawa West Nepean, where we have a number of long-term care homes, and we saw the suffering and the death that happened there. It's been a very hard time for many people in this pandemic, but what the Canadian Armed Forces reported on and found in long-term care is something that we can't ignore anymore. And I think it's something we probably all knew, but it was always brushed under the rug. And because of their report, now we have to act. And our Liberal government has already started acting on it. So for one thing, we don't have a lot of tools at the federal level other than funding and the criminal code and the tax system, because long-term care is a provincial responsibility. But the first thing that we did is we provided funding for things like better ventilation, which you now see in place in places like Villa Marconi, right here in the riding. We also announced in the speech from the throne that we would ensure that we use the criminal code for those egregious cases where you have owners and managers of long-term care that are deliberately neglecting and abusing people in long-term care. But the other thing that we're doing is we're making sure that we're working with the provinces. We've already started on national standards for long-term care, and we're working alongside the provinces to make sure we put those in place in addition to the guidelines that we've already put in place. One of the things that we've promised in our platform is a safe long-term care act. So federal legislation on long-term care that will have $9 billion, which includes funding for 50,000, training 50,000 new PSWs and making sure that they get paid $25 an hour. Because we've also seen that in many cases, it's the overworked and underpaid people that are in long-term care that are one of the reasons why we aren't able to get the support. But it's more than long-term care. As you mentioned, one of your questions is about home care. And we've already put $6 billion to the provinces specifically for home care. We've already created an Age Well at Home initiative, but we need to do more. And it's not just about home care, it's about looking at innovations in different ways to not just have institutionalized care, but different ways at all levels that we can support seniors to be able to live independently longer. And I'll give you a perfect example here in our riding. It's the Carlington Community Health Center and Ottawa Community Housing, just off Marivelle Road, where with federal and provincial funding, we built community housing, so affordable housing, on top of the health clinic. And what that means is for seniors who want to live independently in their own apartment, but have those health needs that would otherwise put them into care, we're able to go down to the bottom of the elevator and get all the care and all the health and the services that they need. This is a model now that we need to look nationally. I also have been talking to community groups like Mind the Gap and like you and my Friday coffee hours, where we've had a number of discussions. And we need to get into a mindset where we're looking at care for seniors, not just as institution. So for instance, in our housing strategy, we are providing funding for multi-generational housing. So if you want to build, say, a mother-in-law suite, you can, to support your family at home, you are now able to get $7,500 in tax credits in order to do that, up to $7,500. So the other thing is, of course, doubling the home accessibility tax credit to $10,000 to build ramps and things like that. But also, we're making the caregiver benefit refundable, which means if you don't earn income, you can still get the caregiver benefit. And that provides all kinds of other ways that you can care for seniors, either at home or so they can live independently longer. We've also provided a number of other things. So as you know, income supports are very important. We increased the GIS for seniors by 10%. That raised over 57,000 seniors out of poverty in Canada. We've also increased by 10% the OAS for seniors over 75, because we know that's when the savings start to run out and when the expenses start to go up. But more importantly than that, we have already implemented a national dementia strategy, and we're already well underway on pharmacare. In fact, we have an agreement with one province on pharmacare. We're putting funding for 7,500 new doctors and nurses, $10 billion in funding to the provinces for healthcare wait times, and a new permanent transfer for mental health. And that's something that will help geriatric mental health alongside the national dementia strategy. And the other thing we know is that a lot of the solutions to seniors isolation comes right here in the community. So we've increased the New Horizons program. It provides things like classes for computers, recreation, quilting, the Old Forge, the programs that bring groceries to seniors. And this is something, the solutions have to come from the community. It has to come from you. So I'm very much looking forward to listening to you going on into the future so that we can hear your solutions to make sure all seniors can live in dignity. Thank you.
Well, thank you, Anita. And again, I love the work that you've been doing, and I really appreciate it. And good luck in the upcoming election. We're now joined by Yves Leduc of the Council on Aging. Welcome, Yves, and I'd love to have a few words from you, sir.
Well, thank you very much, Rick. I hope you can hear me well.
Yeah.
Good. Sorry, there was a bit of confusion about me joining the webinar this afternoon. But I had the chance to listen to both Sean and you, Anita. I've been appointed to the board of directors of the Council on Aging this past summer, and I appreciate that both of you, Sean and Anita, have taken the time to participate in this webinar. I also want to extend my welcome to the participants who have taken the time to be on the webinar today to listen to what you have to say. I'll try to cut my comments short. Council on Aging, a bilingual volunteer-based charitable organization which is dedicated to improving the quality of life of older adults living in Ottawa. And we do strive to promote and champion the basic tenets of an inclusive, caring city and the importance of community-wide engagement with a special focus on the vulnerable and isolated older adults. We work in partnership, as you can see, with NAFR and CARB, and this initiative is a good example of how we can coordinate our efforts. Just like Sean mentioned in his introduction remarks, I have also lost my two parents in the past 6 years. My mother left us 6 years ago, so well before the pandemic hit, and my dad passed away at the beginning of the pandemic. COVID has unfortunately taken him. So I'm bringing this up front because it has allowed me to witness the lack of resources, especially in long-term care home, well before the pandemic hit. And dramatically, the pandemic has taken the life of many older adults. It has also worsened the challenges of health care workers, the challenges that they have been facing for far too long, and allow me to thank them for their dedication, especially throughout the pandemic. So public in general was shocked by the situation, a situation that existed well before the pandemic. And if I have a wish to express here is let's hope that those lost lives are not in vain. And let's move away from pointing finger. What we need leadership. We need leadership to tackle on the challenges that the seniors are going through, not just from a long-term care perspective, but there's a long list of issues: transportation, income security, social inclusion, etc. And I think all of these needs to be addressed as part of a coordinated national senior strategy. So once again, on behalf of the Council on Aging, thank you for being here. Thank you for sharing your party's platform, and thank you for informing us on what you would do personally if you are elected on the 20th. Thank you.
Thanks very much, Yves. And again, I just love your stories, and congratulations on working with the Council on Aging Board of Directors. They do amazing community work, as does our other partner, NAFR. So again, thank you, gentlemen, for joining us today. I'm just going to reach out to Cheryl very quickly. Did Jennifer Jennings from the Conservative Party join us?
No.
Okay. So our next speaker is going to be on video. And Cheryl, I'll get you to open up to Yaver Hamid, representing the NDP party.
Oops.
No sound. Cheryl, we have no sound.
Demographically, it is we
No sound.
witnessed through the pandemic
really just a window in terms of the severity of the problem. Not that it's something
Is it
that,
the way you
that
shared it?
occurred
Is there a
overnight,
button
it's
on the
something
sharing?
that has been brewing in
No.
Ontario. And I'm talking
Okay.
about the Ontario context. I think it's a
Advising
nationwide
there's no,
issue, but in Ontario, it's been brewing for about 2 decades. And at the source of that problem
they're all
is
saying no
really
to
the
sound.
fact that
Cheryl, we can hear you speaking in the background. Can we start it over?
homes being allowed
Yes,
to
we'll start over.
subsist.
Yeah. Sorry about that, folks. Technology at its best. We will start his presentation over. We were able to find his video, so
While we're waiting, is there going to be an opportunity at the end to hear some of your priorities so that we know what to
I'll speak about a few of them. Yep.
be good? I look forward to that. Thank you.
Be candidate in Ottawa West Nepean. And I wanted to first acknowledge that this presentation is in Ottawa West Nepean is being held on the unceded and unsurrendered territory of the Algonquin Anishinaabe Nation. And I want to thank the organizers, CARP Ottawa, in collaboration with the National Association of Federal Retirees and the Council on the Aging of Ottawa for this really important event. I don't think, let me start by saying that there really is no controversy as to the need and importance of having a coordinated national senior strategy. We know that the concern facing seniors is a growing issue. Demographically, it is. We've witnessed through the pandemic really just a window in terms of the severity of the problem. Not that it's something that occurred overnight. It's something that has been brewing in Ontario, and I'm talking about the Ontario context. I think it's a nationwide issue, but in Ontario, it's been brewing for about 2 decades. And at the source of that problem is really the fact that we have for-profit driven long-term care homes. And this is, I mean, the issue of senior care certainly extends beyond long-term care homes, but in the institutional context, there's a real concern about profit-driven long-term care homes being allowed to subsist. And that's nothing new. So what do we need as part of the strategy? The NDP platform, puts forward a position which is probably consistent with a general common sense view. And the first thing is get profits out of long-term care. How do we do that? We need federal funding for it. And that's going to require that increase health transfer payments are made that are targeted where senior care and long-term care support is the priority. Along with that, and as part of the conditionality of those transfer payments, we need to have national standards themselves. Now, national standards also would not really be meaningful unless there is an enforcement mechanism. So an idea that I've spoken to constituents about in long-term care facilities in Ottawa West Nepean is the idea of having an advocate or an ombudsperson to deal with concerns. So you have the infrastructure in terms of the national plan, you have an enforcement mechanism in terms of this, and I would call that position an advocate. It's not something that's specifically set out in the NDP platform, but I think that we have to move ahead. I think that this is not a partisan issue in terms of whether it's a liberal NDP or conservative plan. I think all parties have to be concerned about it. I believe fundamentally that the party to deliver on this is the NDP, because the saliency of healthcare, universal basic healthcare, and now a guaranteed level income is a priority for the NDP, as it's been for decades. And so when we're talking about rebuilding in the post-pandemic context, the notion of putting public funds into healthcare, putting public funds now into pharmacare and expanded dental care is nothing new. Prioritizing that for our seniors is a huge issue. The last thing that I'm going to add to sort of those first three components that I set out in terms of the transfer payments, the national standards, the enforcement, is a focus on mental health and quality of life. And that goes both for care within long-term care homes, but also the transition from other living settings to long-term care homes. It's one of the biggest moves and decisions that anyone can make to go into long-term care. Sometimes it's not a decision, it's something that's a necessity of life, but we all have to be sensitive to that. I want to thank you for having me, and sorry I couldn't attend. I had to attend to a labor hearing today, and I would very much like to speak to you more on these issues after September 20th. Thank you.
Well, thank you, sir. And thank you, Cheryl, for getting him on. And it worked out quite well. Interesting perspective, certainly from the NDP party. So that really closes off the formal part of it. But Anita, you asked a quick question. I'm just wondering how we can respond to you.
Sure. No, if I could take advantage of the fact that we have a little bit of extra time set aside,
Yeah.
To hear from some of you, some of the ideas that you have. I think one of the things that benefits us as candidates, but also assuming if I get reelected, is maybe to hear from you, have a two-way discussion. So if there's anything you wanted to add on what the priorities should be. I know that some of them weren't in the three questions. So I'm here. I'm all ears.
Okay. Well, no, I appreciate that. And yes, we do have a few extra minutes. Again, you heard what our collective areas were in terms of, the national strategy. To me, that's really important. And I've worked at length with the Minister of Seniors for a number of years now. And this policy has been going on for about 6 or 7 years now, and it still has not come to completion. There's just so many key elements to it. I think the key thing that certainly collectively we want to see is some form of completion to it, because when you have a policy that represents seniors across our country, then that affords more opportunity. We understand that the federal government only has certain areas of responsibility, and then a lot of the health related issues then focus back on the provincial governments. So when they let the money, that's when the accountability should come in hand. And right now there's not a lot of accountability. Gentlemen, do you want to respond to that, Robert?
Yes, thank you very much, Rick. And I do remember your name now. I'm sorry,
Okay.
Mental lapse.
I've been called worse.
Yeah, really, the issue that Rick has been talking to you about is very much ours. We're very concerned about what happened during the pandemic. I think it illustrated major failures for our seniors. And we saw the results early in the pandemic about the number of deaths that took place and so on. We think that large investments have to be made in longer term care, in institutions where there are quality staff, in institutions that are well ventilated, in institutions where people have dignity. But at the same time, I think the future belongs to home care, solid home care, because many people prefer to live their lives at home and eventually to pass away at home. And we think that there needs to be some support for that, the importance of providing assistance for home care. And that means having again, the necessary human resources to look after the people and, of course, the financial assistance that they need. I hope that this has illustrated to you what our main concerns are and what we're expecting out of candidates for this election. And thank you very much for your presentation.
Eve, would you like to add anything else from your perspective?
Yes, thank you, Rick. And I would like to echo both you and Robert's comments here. In my remarks, I wanted to stress the fact that it's clear that the pandemic has exacerbated the conditions and the problems that exist in long-term care homes. But those problems have been existing well before the pandemic. And it's in part as a result of cutbacks in budget towards healthcare, long-term care, etc. And we need a major reinvestment in these areas. And it's one thing to talk about national standards, but I think the focus has to begin with a commitment on behalf of the government. Stop pointing fingers here. We need to be leaders. We need to assume leadership and recognize that something needs to be done. I think this is being understood these days by the main federal political parties. But let's be proactive. Let's reinvest in long-term care home. Let's reinvest in health, and let's make sure that we can come up with a national senior strategy that eventually goes beyond long-term care, which is a key priority right now, short term. But there are so many other issues. Housing, we've been talking about housing at the Council on Aging. It's not just from an aging perspective where, you know, as you're aging, your mobility might be affected over time, but it's the houses in which we are living or the home in which we are living who are not properly ventilated. There is no air conditioning. And so you can see a link with global climate change here. So the list of issues is pretty broad. We don't really have time to go through those here. But I think leadership and partnership to have the federal government and the other level of government to participate in partnership with the associations such as the ones that we represent to identify and develop proper solutions to these problems.
Thanks very much, Even. I'm just going to add two more quick pointers to you, Anita. One is you can see the passion and the quality of spokespersons representing these three organizations. We're volunteers. We give of our time, and we're not getting paid for this. The way we're getting paid is because of the changes that are being affected by the advocacy work that we do on behalf of our respective organizations. And we need to work more closely, obviously, with the parties in power. The second one is just to give a little pump for what we're doing here in Ottawa. With CARP Ottawa, we have done major representations and presentations to the provincial government. I'm sure you're quite aware that they had a major commission this past year on long-term care. We've recommended what's called the transformative cultural change in terms of how we look at the long-term care system. And it really brings it right down to sort of a community feel. And in the past, but also in the future, we're going to be hosting a number of different sessions on such models as the Eden model. There are some really key models now being affected in Ontario, a lot down in the Toronto area, but certainly we have one here in the Glebe Center right here in Ottawa, where they're looking at different ways in how to service persons that are within these long-term care institutions. So that's where we need your support. Please feel free to comment.
Yes, no, thank you. And I'm really glad we have a chance to have this exchange. I do want to say to Eve, condolences on the loss of your parents. I lost my dad in November as well. So You know, it's a hard time to lose people because you don't get to grieve in the same way with community, and I think so many people have experienced that during this pandemic. So I also, the fact that you're doing this as volunteers, I really, I want to say how much I appreciate that, because for me to be an effective legislator, I need that input. I don't know enough myself about what is needed and what's happening. So we need those voices. And I really strongly encourage you to keep on doing that. I'm really glad I was able to, we have that little bit of extra time today so that I can get this input. But I can assure you that if I am reelected, I will continue to, and I know I have in the past, but I will continue to meet with you and listen to you, especially as I think, like in the Great Depression in the 1930s, the federal government stepped in ways, in areas that were very provincial, like EI, like pensions. I think we're in a similar place now, where the inability of the provinces, I mean, the fact that they had to call in the military and the Red Cross, does give openings. But as you mentioned, the national standards are national, which means the provinces and the federal government have to sign on. I'll certainly be looking at federal standards, federal strategies as well that we can do as a federal government. But I hear you. I hear you about the needs, and I very much look forward to continuing working with you and with others. I do a Friday coffee hour every week, and I know some of your members have joined who are constituents to bring up these very issues. And for me, that's the most helpful thing. So thank you so much for holding this. Thank you for giving me these ideas, and I hope we'll get a chance to continue talking into the future.
Well, again, thank you for joining us today. And one of the things I like to leave with when we have these sessions is, and I speak about the volunteers in terms of the 3 associations. There are many, many associations in Ottawa. And at the end of the day, we know that seniors get out to vote. And because there's so much passion in the issues that affect us, we want to affect some change. So again, thank you for your time. And thank you, folks, for joining in. Thank you, Robert and Yves, for representing your organizations. And folks, we'll convene this meeting at this point in time, and see you all again soon. Thanks very much.
Thank you, Rick.
Thank you, Rick.